Good afternoon. As already mentioned, my name is Gabrielle Rolland. I'm a general surgery resident at Walter Reed, and I'm going to be taking the next few minutes to discuss a study in which we analyze the attrition rates in military general surgery residency programs. So Dr. Ritter receives royalties for an endoscopic trainer, but this will have no bearing on my talk today, and as everyone else, the views presented this afternoon are my own. All right, so why did we decide to look at this? So it really started with a study that was published in 2017 in which they looked at the attrition rate in general surgery residency programs in the US. What they found was that across the board, the attrition rate was 20% for general surgery programs, which is significantly higher than the other medical subspecialties, which sit around 10%. The other thing that they commented on was that when you looked at military programs specifically, this already inflated rate increased from 20% to 35%. So we found that pretty concerning. One, as you all know, we already have a general surgeon shortage in the military. The other thing that we noted was that our interview process is pretty rigorous. So medical students rotate at their program of choice for about 2 to 4 weeks, which is significantly longer than the common single-day interview at civilian programs. The other thing that we realized was that this really didn't seem to reflect what was going on in our own programs. We thought more people made it to graduation than they had specified. So we delved a little bit deeper into the methods of this study and found that the way that they tracked individuals was by ensuring that they took the ABSITE every year and then eventually sat for their boards. So any deviation in that normal schedule was counted as attrition. So looking specifically at our population at the time frame that they did it, it was still commonplace for both the Army and the Navy to have an operational tour. And so therefore we thought that without taking that into consideration, perhaps our attrition rate was actually lower. So with the help of all 12 military health general surgery residency programs, we were able to collect data on all 184 residents who became categorical between the years of 2010 and 2013. During that time, it was common for the Army and the Navy to use operational tours in the middle of residency. So the categorical year for the Army and Navy was the PGY 2 year, whereas the categorical year for the Air Force was the PGY 1 year. We collected demographic information on all of these individuals, and you'll see on the slide there are 4 of them that have stars next to them. So those are the characteristics that have been previously studied in depth as to the cause of effect, or the effect on attrition, and the other 2 we added to specifically look at military effects. So for the individuals who did not make it to graduation, we asked about the timing of attrition, meaning what PGY year did this occur? And then also we looked at the reasons for attrition. So the options included resignation, termination, and resignation in lieu of termination. For those who resigned, we simply asked why. For those who were terminated, we asked about a little bit more information on up to 3 ACGME core competencies that may have led to this decision. So here on this slide, you'll see 6 pie charts. It's covering all of the demographics of the individuals who became categorical during those years. I would like to point out for gender and for degree type, we're on par with our civilian counterparts. So in our population, 32% are females, whereas in the civilian world it's 38%. And then 18% of our residents are DOs compared to the 20% in the civilian world. All right, so what did we find? So what we found was that 19 of those 184 residents didn't make it to graduation, coming out to an overall attrition rate of 10.3%. Of those 19 individuals, 15 resigned, 2 resigned in lieu of termination, and 2 were terminated. Of those 15 who resigned, 13 decided to change to a different medical subspecialty. And for those who resigned in lieu of termination or were terminated, the most common core competency deficiency cited was professionalism. So here is a table where I show the effect of attrition based on demographic. So what you'll see is that there's no statistical discernible difference between branch of service, gender, or degree type. But I want to bring your attention down to operational tour. Though it wasn't technically statistically significant, it did trend towards significance, and immediately looking at those numbers, it kind of took us a little step back, with those who performed an operational tour having an attrition rate of 18.2%, which is double of their counterparts. So when we put all of this information into univariate logistic regression, what we found was that marital status and age were the significant predictors. So those who were married were almost 3 times more likely to make it to graduation than their single or divorced counterparts. And those who started their categorical contract under the age of 35 were about 5 times more likely to graduate than those who started their contract at the age of 35 or greater. All right, so what does this all really mean? I think first off, we can safely say that our attrition rate is lower. Whether this is due to a better interview process or whether this is due to the inherent commitment of our residents to their military service and their career, I don't know that we can specifically say. I can take some time here in a second to discuss the effective interview process, but I don't know that you can scientifically study the effect of commitment on anything. So looking at the interview process, so last year a study came out in which they evaluated selection science and use in residency selection. And so they used tools such as situational judgment tests, task evaluation, and personality profiles to help with the match process. And what they found was a more effective match as well as a lower prediction in attrition. I think if you look at the way our interview process is set up, during that 2 to 4 week rotation, you kind of inherently get that information from working with these individuals on a day-to-day basis. And I think that gives our program directors a greater amount of information to take to the selection board. When looking at marital status, so this has been something that's been evaluated multiple times. So some studies show that it's protective against attrition, meaning that having strong spousal support can help people get through residency. While as others have cited this as a reason to leave residency, with some people concerned that the lifestyle may have an effect of a strain on this relationship. I think our data kind of points towards the protective effect of this, but I don't know that we can really speak much further about it, as we didn't collect any data on whether or not these relationships were sustained. When it comes to age, this is something else that's pretty controversial. Some people say it has certain effects, some people don't. I think taking into account all of the information that we have right now, I think it's possible this is a marker of something else. So the effect of operational tour trended towards significance. If you look at our population, there are many people who have had careers beforehand, military careers, and then people who go on operational tours. So I think we need to collect some more data to kind of pick out really what that effect is, to examine age by itself and operational tour a little bit more by itself. So in conclusion, the previous estimate of attrition was incorrect, and I really do think that this speaks to our civilian researchers not understanding what our GME selection is like. I think looking at age, specifically, if we were able to get some information on attrition during the time period that the Army moved from an operational tour to a more categorical selection at the medical student level, we may be able to parse some of that information out. And really, I think I can comfortably say that our current interview process, whether intentional or not, is working pretty well. So that's all I have for you. Thank you for your time. I'm happy to take any questions.